Okay, thank you very much, Yves, for this introduction and for introducing this session. So, as Yves Lévy mentioned, the aim of this session this afternoon, the aim of this symposium, is actually to see what can research do for climate change? I mean, what are the, research from people that are directly involved in climate change and health issues, but also from people coming from different disciplines and that can really increase this community of people involved. I mean, how can we increase the community of researchers involved in this field? What can we do to help research, and how can research help the climate change issues and try to push forward some of the solutions. So I'm going to start with a small general introduction and tell you how can we see the climate change and health event in the context of the Exposome concept. And I'll try to go very quickly, and I will ask all the speakers also to stick to their time, because the afternoon is quite long, and we have an important roundtable at the end of the afternoon, and it's really important to do that. So this is a general framework of the exposure, response, and adaptation that is shown by in an important paper by the NRC on the exposure science of the 21st century. It shows some classical trends like the relationship between the source, the environmental and intensity stressors, receptor being either the individual or a population, and which can be influenced by its own behavior or by natural or human factors too. And this leads to a response outcome that could be disease. And as in function of this response, there's a feedback back to the source and a feedback back to the individual behavior. I think the interesting thing about this scheme is that it represents the interaction between the sources of exposure and their effect on individuals and the response of the individuals on the source themselves. So it's an interactive story, and between the ecosystem and the human well-being and health, there's always a very complex interaction. This is actually also shown here from the same report, which with a picture showing how the ecosystem services, such as providing food, water, fuel, regulating climate, floods, disease, and cultural aspects, could influence several aspects of human well-being and health, such as personal security, for example, having the basic material for a good life, health, and good social interactions. So there is really an influence of the ecosystems on human health, and this is so-called One Health concept that is really important here. The initial definition of the exposome was provided by Chris Wylde from the International Cancer Research Center in Lyon, and the aim of Wylde when he proposed the exposome concept is to try to unify, everything that is not genetic. Basically, we know how what's the influence of the genetics, and then for anything that are related to exposure, it was really many different aspects and not unified. And he tried to propose a concept that tries to unify all the other exposures. So it's the totality of exposure that an individual can experience from conception to death over life. So these are very important. It's the totality of the exposure all over life. And since Wylde, then many other, of course, scientists have contributed to this concept. Each one has brought something different. So we talked about Wylde, and so Rappaport and Smith talked mostly about the internal exposome, how by exploring blood and the internal fluids, you can have an idea about what are the exposures and what is the reaction of the individual. I mean, so they have a sort of metabolomics and proteomics approach to exploring the general exposure. Buck-Lewis added actually a few important issues, such as the mixture of environmental exposure as an important aspect, and also didn't stick to like chemical, physical, or biological agents, but also to macro level factors such as population density, sanitation, lifestyle factors. So it's a larger view of the exposome. And as I said, the NRC report spoke about the eco-exposome, where they made this interaction between the ecosystem and the human health. So this is kind of view, and the influence also of the humans on the ecosystem was part of that. So those are the different aspects of the exposome. So we end up with a real complexity of exposures, the stressors that we have talked about, the sources of the stressors, where it's, is it the workplace, is it at school, is it in the city, whatever. The time is important. It's not the same thing to be exposed when you are a fetus, a child, or an adult. The route of contact, the distribution of the, if it's a chemical, for example, and the target with the biological pathways that are more or less disrupted by these exposures. So the time dimension is also critical, and when you think about time, there are different aspects of time. You can have, we are talking really about chronic exposure here, and so you can be exposed to a stressor either through the reiteration of the exposure. For example, smoking or air pollution, you are exposed every day, and it's cumulative over the time period. It can also be a different aspect is persistence. You have a short external exposure, but then this, these, for example, persistent chemicals can stay in your body, and you have a long-term exposure that comes from inside your body. And also the last aspect is developmental programming, where you have a short exposure, for example, during a particularly vulnerable period of development, the fetus, and then you can have a delayed response that appears either as a child or an adult or in the elderly. So this also can explain long-term effects. So it's very different, and even climate change could be included in those different aspects. So exploring the exposome, by definition, it's an exploration at different levels of complexities. It starts with a regional ecosystem level, to the community, the individual, the blood, and even all the way to the cells. And that's what people in the exposome business try to do. And if you now compare to people working on climate change or just air quality, you can almost do the same at the very individual level, local or regional, or a very large global level, and you can have the same. So there is this parallelism between people working on the exposome and people working on air quality and climate change. There are many different approaches, and we will see many of those this afternoon, actually mostly in the second session, but maybe in the first one too. You can have global systems to explore climate, or to explore any pollutants or anything. You can have individual sensors that are extremely used now for either environmental assessment or for individual behavior or parameters. You can have, of course, surveys. This is quite traditional in epidemiological research, and biomarkers when you explore it at the individual level. But in all cases, you have a lot of data, and you have to analyze the data, and we will have talks about how to analyze data in these fields and different fields. And importantly, because I said the exposure is important and time is important, the sort of hazard trajectories are quite important in an individual. This is the time here, so you can go through exposure, for example, at the workplace here, or in a different city here, et cetera, and you can follow during time for an individual the different exposure pathways. So if now I shift to the climate change, and you will see that there are many similarities between the presentation of the exposome concept and the issues related to climate change. Climate change has been subdivided into different effects. You can either have direct effects of climate change, such as storms, drought, floods, heat wave. And you also have indirect effects on water quality, air pollution, land use, ecological changes, etc. But all those interact with a number of social and individual issues, such as age, gender, socioeconomic status, and public health, infrastructure, and etc., and political issues, actually, such as mobility. These factors influence a number of illnesses that are related to climate change. Among them, of course, cardiovascular, infectious injury, allergies, undernutrition, mental illnesses, etc. So there is a complex interaction, and this is typically an exposome type, mode of thinking. Even when you think about infectious disease, there's not only a single mechanism for climate change to induce infectious disease. Of course, we all know what happens with vectors such as mosquitoes, but we have also infections due to water quality, to food quality, etc. So there are many ways by which, even for one single disease, the climate change can have an influence. The other important issue is that many of the pathologies that are induced by climate change are also the targets of different environmental stressors. Climate change is not the only stressor that would lead to such pathologies. For example, if you're thinking about respiratory and cardiovascular disease, which are related to air quality, of course, we have issues related to climate change, such as ozone and some volatile organic compounds, but the issue of particles is also important. That can be either due to climate change, but to many other problems also. And the pollutants, whether they are chemicals or biological, can also influence air quality. So you have to integrate all these stressors. Same thing with infectious disease. It can, of course, infectious agents can come from really many different origins. Heat can influence the outcome of the disease, and contaminants, for example, if there are immunosuppressive contaminants, can also have an influence. And for allergies, we also have the involvement of pollens, mold, and also contaminants. And you will see examples of these three issues in the first session of the afternoon. So some of the conclusions, and let me give some of the conclusions to tell you why we think that the exposome concept can help in the climate change. First, the effect of climate change on health are numerous and diverse, and many of these health effects are also targeted by other environmental stressors. So the exposome concept, which aims at integrating the effects of all those exposure on human health, I think is quite relevant in this case. Some of pending issues, in fact, in several cases, the percent contribution of each stressor to the health endpoint remains not quite well determined. It's difficult to determine. So we know that climate change or other stressors have an influence, but what is the part of each one is not easy to tell. Second point is studying the interaction between these different stressors is highly relevant because the effect of combination may be either negative, worse, or may sometimes positive. It's possible. So. And the impact of public health actions should integrate all the stressors and not only focus on a single one, because if you're good for climate change, you may not be good for the other stressors. You have to be good for all of them. Otherwise, you're not doing what you should do. Finally, how can we help? How can the exposome concept help? Well, I think that the combination of even mild exposures can produce significant health effects. For example, if you combine infections with a health status and with an immunotoxicant, chemical contaminant, then you may have a really bad outcome out of this combination. Second, concomitant mitigation, even if it's partial, of the different stressors can lead to significant outcomes because they all may contribute to the same effect. If you do something about them all, that may be helpful at the end, even if it's partial. Third, past and present socioeconomic and health status, as well as the vulnerability, should be taken into account, as we said. And finally, risks versus benefits balance and co-benefits should be assessed taking into consideration the full exposure landscape, not only those that are related to climate change or to any other stressor, but really take the full landscape of exposure into consideration. With these thoughts, I'm going to leave you now, and I think we should start immediately the second session, the first session, sorry, not to lose time. I don't know if Mathilde is here. She said she may be late, so if Mathilde is not here, I will play the chairman and ask the first speaker. Rémi?